Thank you very much. How do I use this? That way. Okay, I have some slides. So I have 25 minutes apparently to tell you the last 15 years at Sutter Health. I'm very happy to be here, and let's jump into it. Do we have the slides? There we go. So I'm going to be talking about a new phase of healthcare project delivery. It's really a journey that we've been on to try to improve the way we deliver our capital projects. It's those warships. Okay, so a little bit about myself. I've been in healthcare development for the last 15 years. I studied here at UC San Diego, but I was more of a management science economics major. What that means is I majored in spreadsheets. And that actually seems, now that I've gotten involved in lean construction, actually seems more relevant than it did when I first started. Most of the work I did was lump sum, so pretty much all of my early jobs had claims on them. They had delay claims as well as a lot of change orders. My best job was a $4 million job with a $2 million claim a year late, and we VE'd out the last phase of the job because we couldn't afford to build it. Then I got involved in more guaranteed maximum price, CM at risk, and that made a lot more sense, but we still had some pretty big overages, and so we've been moving more towards an integrated, more collaborative model. And I know a lot of you can't do it or won't do it, but so I put this together so there's some things that can be used in any delivery model. And not only that, but I'm also a consumer, so I have 3 small kids. My youngest just got his first stitches. I'm very proud right here on the chin. And my oldest son is 7, and he's actually driving the D8 there. He was born with Down syndrome, so we have now got a whole bunch of experience going through the healthcare organization. And so I'm very committed to making it a better place. So I'll introduce Sutter for those of you who don't know it, talk about what our role is at Sutter and matching with that vision, and then our 15-year history. So those of you who don't know, Sutter is an integrated health system in Northern California. We have about 50,000 employees, so those are the counties we serve. And it's a pretty diverse organization in that we're one of the largest. We treat patients that speak over 100 languages. We deal with some of the wealthiest counties in the country. We also deal with some of the most impoverished counties in the country. And we spend a lot of money in construction too. So we spend generally around $500 million a year. Last year, 2018, we spent just over $1 billion finishing some projects in San Francisco. So overall, Sutter's mission is to enhance the well-being of people in the communities we serve through a not-for-profit commitment to compassion and excellence in healthcare services. That vision, Sutter leads the transformation of healthcare to achieve the highest levels of quality, access, and affordability. So I work in the facility and property services group, so we do construction management, design, real estate, and I'm specifically focused in construction. Our department came up with our own why, borrowing from Simon Sinek's Golden Circle, that we empower healing environments. So that was collectively the 150 people in our group said, what is it that we actually do? And so what that means is we provide great facilities on time and on or under budget. When we first started looking at a $5 billion capital program, all of our early projects had been, big jobs, over $100 million, had been very late and over budget. So there was a real concern that the company might go bankrupt as we had to actually meet these seismic requirements. So a little bit about that. You're familiar, if you're in California, we have these things called earthquakes. So in the early 70s, we had the Silmar earthquake. Some of the hospitals collapsed. They created the Office of Statewide Health Planning and Development, which regulates the way we build and inspect our hospitals. We had the Northridge earthquake in 1994. There were still problems. So they created Senate Bill 1953, which we had to bring all of our hospitals up to meet new seismic codes. And if you've done construction in a hospital, you don't just move the operating room to another floor so you can do the seismic retrofit. So in most cases, we ended up building a new hospital in the parking lot and moving everybody over and then repurposing the old building. So we had to do at least 8 hospitals, somewhere between $5 and $7 billion worth of work. And there's a whole bunch of deadlines. OSHPD also is, they make us better. You have to build it exactly the way it is on the plan. So traditional delivery it wasn't working for us. There's also that just big projects in general, this is the Construction Industry Institute, and almost 1,000 projects, average size of $65 million. Only 28% of them actually meet or exceed their schedule and budget goals. So it wasn't just us, which made us feel a little bit better. And then my counterpart, Digby Christian, he likes to come up with very good concepts on why this happened. So he came up with the stagnation equation, which is basically performance is terrible, the owners aren't paying attention, including us. Everyone else is making money, so nothing changes. So how many owners in the room? Let me see. So we get what we structure our projects for, and that's really what I've learned over the last 15 years. And if we don't change the way that we structure our teams and the way we run them, then we're going to keep getting the same results. And if you look, most contractors have new trucks, and they're doing fine, so they're not going out of business, right? Every time I get frustrated with my car, I'm like, I'm just going to go work for a contractor because at least I'll get a truck, you know? So we started in the early 2000s to look at a different way of delivering projects. So, and what you'll see here is it took us a long time in a number of different iterations. So 2004, we organized a Lean Summit with over 200 people from the design and build community. It was held in Concord and facilitated by Lean Project Consulting. Out of that, we developed the 5 big ideas. The thought being, no matter what the delivery model is or the contract type, if you focused on real collaboration, which I think we'll hear a lot about here, optimizing the whole and not the parts. So most lump sum contracts specifically, right, it's about chunking up risk and transferring it around. So you actually end up pitting design and construction and different partners against each other. So if we could get it so everyone cared about the whole project, and managing projects as network of commitments and increasing the relatedness and tightly coupling learning with action. So that's about a feedback loop that every time something doesn't go the way we thought, we actually try to fix it instead of just, it's like, oh, this always happens and it'll continue to happen forever. So not only that, everybody signed off on it. So people signed off and said, okay, we agree. And then the projects didn't get any better. So we hadn't changed the model. So this was one of our first projects, finished significantly late and over budget. And a theme that I want to be clear on is this isn't because we didn't hire the right people or we didn't have good managers, the designers or the builders weren't good. They're the best in their game. It's the model, I think, that really failed. So time to change everything again. So we changed the contract. This is Will Lichtig. He was actually our counsel for construction-related matters and also wrote the first integrated project delivery agreement. So we just kind of lucked out that he happened to already be our counsel. So this was more of a GMP with shared savings, but it was like 10% shared savings. We started doing more guaranteed maximum price with the major subs instead of lump sum for MEP, and modeling was also just starting. And that didn't work either. So I worked on the upper left-hand project. Looking back, this was a steal, a great building. At the time, though, when we went from a design development estimate to our GMP estimate in a 6-month period, the construction cost went up $80 million. And so on the contractor side, of course, because the scope changed, right? But from the business plan side, doesn't have any more beds, doesn't have any more ORs. It's the same building for us. So I actually went back and found the board presentations. It's really fun to explain how the same building cost $80 million more 6 months later. Then the project on the lower right, same thing happened basically. It finished more like 3 years late and significantly over budget. I couldn't say how much because it just depends on which budget you want to compare to. So again, these are really good people. Our best in-house project managers, it wasn't a good way of setting up the project. So then we tried this first three-party agreement, which Will was brought to our in-house general counsel. So we did it. We built a medical office building. Actually went really well. It wasn't as hard a building, but went really well. The team finished way below budget and got nothing for it because we had no shared savings in there and we hadn't worked out the profit at risk piece. So the team came back and said, well, that worked really well, but it didn't really benefit us, so why would we want to do that again? So then you have, okay, completely, so starting in 2007, the last 5 big hospitals that we've built have used a completely different model, which is this idea of integrated project delivery with a shared risk and reward model. So I'm not going to talk a lot about this. There's a pamphlet in your book on integrated project delivery that you can read. But basically, you're creating a virtual company, and if the project goes well, then everybody gets their profit. Doesn't matter what their individual performance is. If the project goes poorly, if any 1 or 2 trades fail on the job, everybody, including the design team, loses profit. So what it does is like people really start to work together because they actually impact each other. So change everything part 5. What this meant is once we really got the teams to agree that they were in a virtual company and understand that if I'm in the field and I submit an RFI that doesn't actually have an answer, right? It creates a wild goose chase for the design team to figure out what the question really is, then everybody is paying for that inefficiency. So in this model, what we found is we had to change the way we ask questions, the way we run meetings, the way we detail the jobs, the way we actually where people sit. So this is just a partial list of what, and this developed over really from probably 2010 to 2019. This didn't happen overnight, and it wasn't like an architected thing. It just little by little that coupling learning with action. So we started co-locating using target value design. So that was the big, you can't go from DDs to your GMP estimate and have the number go up $80 million. That's bad, right? That's a little bad. So now what we're doing is we're committing to the number very early, and we're doing weekly updates on what the budget is and tracking every little change. And what we've found is we are now able to, from an early schematic design level, get the building open for what that early schematic design estimate is. And it's very hard, right? This doesn't make it easy. Building a hospital in California is very hard. You have to model it. You have to think more of like you're designing for fabrication. And so I'll share a couple of examples of things that regardless of integrated project delivery, if you're using design build or CM at risk where you can get people on early, lump sum, it works okay. You can get people on board early, but they're still pitted against each other later. But what I want to share is what we found to work. So probably the number one thing that we did is invested up front in what we call a validation process. So we bring the design and construction team on board early before we even go to the board to ask for funding. So if we think it's going to be a $300 or $400 million job, we'll invest between 1% and 2% of that expected final budget to hire the designers, hire the contractors, iterate with our strategy and with our program folks to come up with what we call a validation study now. So any job over $10 million has to have this. And it gets signed by the lead designer, the lead contractor, the project manager in my place, and the lead user. And what this does is it provides a schedule and budget that the team is confident that they can deliver, that's also coupled with the business plan that can afford to pay for that. Because as you know, if your costs are going up in a hospital, the easiest way to bring them back down is like get rid of your ORs or your MRI. That's also a big surprise where the money comes from. So you have costs going up, revenue going down, and there are hospitals in this country that have been built that will never make money, right? You've now brought a multi-billion-dollar asset into place that's going to lose money for the next 50 years. So that's not good. Even if you're a not-for-profit, that's not good. So I say we're a not-for-profit, not a non-profit. The profit just, or a loss, whatever you want to call that. So the money gets reinvested, and that's what builds these facilities. So this, I think, we use this now in CM at risk. We would use it in design build. This is not an IPD specific thing. If you can invest 1% to 2% up front, get everybody on board. And so usually this is like 80 to 90% schematic design. Some things go pretty far into DD, like a patient room. If you're going to build 200 of them, you want to have that pretty well figured out. So the team then puts their profit at risk based on being to deliver what the intent of the validation study. So our contract now is for the intent of the validation study, giving us the rooms that we need to operate the hospital. It's not based on a drawing with a date, and that's the first kind of, oh, this is different. So all through the job, we go back and say, what was the intent when the validation study was put together? The other big thing it does is it locks the user in. So we have a very intentionally bureaucratic process now where you cannot materially change the validation study. You can't change the imaging equipment. You can't change the ORs without going to the COO of our 50,000 employee company. So I used to get my arm twisted all the time by the director of imaging, and I would be using my project contingency very early to fund things that were never funded in the first place. So the other thing the validation study does is some projects are over budget and some projects are underfunded. It's true, actually. So this allows us to appropriately determine the realistic budget for the project. And we have had, on rare occasions, projects that didn't go forward, where we did a validation study and it was going to cost more than we could afford, and so the project got shelved. And we don't do that a lot, because if you spend 1% to 2% of a project in our organization and your project doesn't get funded, that's a period cost. You write it off on your operating budget. So generally, they don't invest in it unless there's pretty good alignment in the organization. So validation, do that no matter what your contract type is. Scheduling, so anybody ever had like a 3,000 line item schedule? My brother's a design build mechanical contractor, and I went and had coffee with him at his house one day, and he had 20 pages laid out, and he was highlighting it, and he was trying to figure out what he was supposed to be doing for the schedule. And I asked him, so is that good? And he's like, no, I just have to know what they think I'm supposed to do so I can document when none of this actually happens. And I'm sitting there going like, this is such waste. I mean, he's getting paid, right? And so all of this back and forth, one way or another, to the owners in the room, you pay for that. You just don't see it. Once you go to a cost reimbursed contract, all of a sudden you start to realize you're paying for all kinds of stuff that don't show up as value in the final building. So it's that value is what you get. That I like that. I own like 3 shares of Berkshire Hathaway. So, and I don't know any watering holes here actually, because I didn't have any money when I lived here. We never got to go out. Save on, that was it. So what we do now, we incorporate the designers and builders in actually building the design schedule, building the construction schedule. So this is a project, this is about 6 months ago, before we've even gotten funding for the project, where we have all of the people, I see Ron over there, facilitating this, which is actually, and this creates buy-in. This goes into the validation study. Later, people say, well, that's what you said. And I said, no, remember, you were there. That's what we said. You were part of that conversation. So this is the schedule for a 4-year ground-up hospital addition. This is what's in the contract. That's the level of detail. All of the colors are the design phases, and all of the orange is the construction phases. The point is, it's not this huge, massive document. We're designing for fabrication, not designing for intent. So what we're trying to do is actually finish the shop drawings before we submit for permit. We want things at a fabrication level. And then once they're at the fabrication level, you actually need to go ahead and get that information to the field. We have a lot of work to do on this. We had a clash the other day, and we went back to the model and said, how could we have this clash? We spent all this money. Guess what we found in the model? A note that said, resolve this clash. So it's not perfect. I mean, even though you're trying, so that was identified, and we didn't have a process to make sure that the clash actually got resolved. The other thing that I think is borrowing from the Toyota production system, we're trying now to set up our construction for actual flow instead of just looking at task dependencies. So on the bottom right is looking at, that is a tack time schedule where each trade gets a set amount of time and each trade gets the same amount of time in each area. So that cascading is for the build out of a 9-story building. And the thought is to get flow all the way through the building. Again, in a lump sum or a CM at risk, everybody's not impacted by the flow. The individual trade is impacted by having poor flow. But in this model, if the mechanical contractor has really bad flow, then the architect, the structural engineer, the general contractor, everybody's paying for it. So we've found that our planned percent complete, our schedule reliability goes up when we focus on flow. And the trades actually have said, it's so much easier for me to know who's working where. So if I need to get into an area, I know who's supposed to be in that area, who's not supposed to be in that area. And we have a lot of work to do on this, but the early projects have been, we just built 1 million square feet with this model in downtown San Francisco. Because if you have no laydown area, this also helps you know what material needs to be delivered for what location at one time. I like this picture. So this is the traditional risk management. So the lump sum work that I did, it was all about reading the contract, reading the documents, and making sure that I was sending the right emails. And I spent a lot of time actually, I took the meeting minutes for that project with the $2 million claim. And I can't tell you how many comments I got for every time I issued the minutes, arguing with like 1 or 2 words in the way I wrote, because everybody's getting ready for a claim. So in this model, we do what we call risk and opportunity tracking. If it's not a change to the scope, meaning if I'm not adding a floor or building out shell space, it is not a change order in our contractual model. So we're managing these things down to like a $2,500 level on a $112 million contract. And what we're really focusing on is like, what's the most cost-effective, most efficient way to actually fix this issue? We're not spending time figuring out whose fault it is. I had a project where we had a major design issue. What was so nice for me is I know that in my previous experience, nobody would have done anything until we figured out whose fault it was. And then we would have started. And this was a really gray issue. We never actually figured out whose fault it was because we had provided design criteria and the design criteria wasn't right, but the system failed before it met the design criteria. And so I said, did I change the scope? And the answer was no. Okay, so it's not a change order to the owner. Now what's the most cost-effective way to actually fix the issue? This, I think, could be set up in any kind of CM at risk. Design build, even if as the owner you're comfortable that you're protected with a design build contract that has a cap on it, I would highly recommend making sure this happens, and then the owner should participate in this meeting. A lot of times there's a lot of argument about how to fix something that we don't really care about, and there's other times where people gloss over things that as an owner we really do care about. So the owner, you're the only one who can actually represent what the owner wants. So you need to be there, in my opinion. So the other thing this is the project in San Francisco that I talked about, 1 million square feet on a full city block. The lesson learned here was we had these weekly milestone check-ins, and we were getting so far off in 5 days because you have an office space here with 200 people from 17 companies showing up every single day working as a virtual company. A week goes by, that's 200 people working, more like 10 hours a day. So you can get pretty far off. So they started doing a 30-minute check-in at like, I think 11 o'clock every single day with this it was pretty seamless by the end, report out structure that says, this is what I did in the last day, this is what I'm doing tomorrow, there's nothing constraining me. If anything's constraining them, they have a breakout and they gotta fix it that day. The point is you're doing this, right? Just minor corrections as opposed to major corrections, trying to stay on plan. And who would have thought? So you can have an integrated contract where everybody's profit is at risk, and you can use all of these lean processes, and it can still feel pretty traditional. It can still feel pretty adversarial. So we've actually started investing in, this is co-location at the top, so this is a $100 million project, 40 full-time people from 6 different companies doing the actual detailing. They're sitting right next to each other. And in the back of that trailer, we have what we call our big room, which is where all the collaborative planning is done. We're doing training together. And then we set about every 6 to 8 months, we actually built it into the budget to have some kind of team building event. So when we signed the contract, we all went to Topgolf. Anybody been to a Topgolf? It's a lot of fun. It's like a bowling alley at the driving range. This is the head superintendent and the owner for that project. So we had a look-alike day, the owner project manager. So what I didn't show is there's actually 30 people that dressed up exactly like that, but the superintendent and the project manager he won the look-alike contest, clearly. And then we actually have once a month on Friday after work, the team has a poker tournament. So these are all just things, if you can have a beer and play poker, and then Monday morning an issue comes up, it is way easier to talk about it than, the other common thing that gets said is when people actually meet, they've been fighting through email for 6 months, when they actually meet each other, they're like, that person's not actually that bad. So that goes back to the big idea of like increasing relatedness, actually trying to get people to work together. So it actually works. I'm going to wrap up. So in the last 11 years, and really when these jobs got started about 11 years, we've delivered 24 projects with this delivery model, $3.1+ billion in actual project spend. All of them except one were under budget and ahead of schedule. So I'll talk about the one that wasn't. We had, remember that 2009 thing, the market went down a little bit. My 3 Berkshire shares got crushed. So we had the skin contractor for a brand new patient tower go bankrupt. And so with OSHPA, that's a design build system. You don't just go get somebody else to install the skin system. So it's actually the bottom right-hand corner. So that patient tower, the skin contractor goes bankrupt. We have to bring somebody else. I think at the end with SubGuard, we worked it out. The project finished 3 months late from the contract schedule, and it was $3 million over budget on a $450 million program. So once they got over the initial shock, it was like, that's not that bad. I mean, 100, 200 million was kind of the norm before this model. So that's our biggest failure, is $3 million over budget and 3 months late on a ground-up patient tower in downtown Oakland. So a lot of these, so the lower left-hand corner, this we actually opened for patients. We've been working on this project for 15 years. With this current iteration, it's 1 million square feet. The corner of Van Ness and Geary. Van Ness is actually an interstate highway after the earthquake. So think of all the jurisdictions that you have when you do construct. We actually built a tunnel under Van Ness because we have a medical office building on the other side of the street. And that project has given back, before they finished construction, they gave back $50 million. We're going to give back $150 million total before it even opens. So it opens in March. So that was the hospital that everybody was worried about, like might bankrupt us, our whole department. We were all going to get fired. So it's like, whew, it worked. So now back to Digby. He's come up with the realization equation. So performance is terrible. And I don't mean that, again, I want to be clear that people are good, that the process is broken. So go back to that original, projects are late and they're over budget. There's plenty of data to show that. The owner's now paying very close attention. The team is at risk, so if the job doesn't go well, we might not actually make money. If the job goes well, we're gonna get our profit plus some. And now everything changes. Asterisk. See that? That's the little. So we developed this slide afterwards to say, if the owner is deeply involved in the project, if the owner is actually a committed, transparent partner, if the owner is open, there's give and take between the owner, and if the owner leads the change. So I can't say this, there's a lot of people that have gone out for collaborative delivery models, and then the owner does everything the same, but it's like, but you all should collaborate. And then when it doesn't go well, I'm gonna use the contract rules, but I want you to pretend that we don't have those unless something goes wrong, right? Anybody had that conversation? So I think that you're set up for failure when that happens. So what's next? Just closing out. So we have at least 4 new hospitals. I mean, the MPC, SPC is changing a lot. So we're not sure exactly, but we're gonna have to spend a lot of money. I just don't know exactly where it's gonna be yet. Like I'm sure you're gonna hear here, better, faster, and cheaper. So I'm personally involved in working on a prefabrication setup with a company to try to kit things so that from initial concept to first patient, we can compress that time. And I think we're gonna be using our data and standardizing things a lot and try to be just much quicker from initial funding to first patient. And so if this piqued your interest, I was involved with a number of legal, research, design, and construction experts, and we put together a guide. This is about a 150-page guide that you can download for free. It was funded by the Charlie Pankow Foundation, and it's not to convince you about IPD, it's to say if you're interested in IPD, here's things you should consider. It's more of like a guide to actual implementation. And I think for CM at risk or design build, there's a lot of concepts in there that would apply. So with that, I want to say thank you. I think I'm right at my 30 minutes, so I don't think we have time for questions. But I would love to talk to you more, so find me. I'll be here till tomorrow night. And yeah, go out and be the change. Thank you very much.